We're getting answers to the most embarrassing questions from author of Health Magazine's new book, What the Yuck, Dr. Roshini Raj. Hey, Dr. Raj. Wearing tight jeans, really, can that cause damage to my body if the jeans are too tight?
Okay, so damage might be going a little far,
Okay.
but it can cause some problems.
And I'm talking about in the crotch area with the jeans, not the back pocket.
We know where.
Okay,
We didn't think it was the calf.
Okay.
Could have been varicose veins.
So what's the damage?
Okay, so when you're wearing very tight jeans, it can put pressure on your bladder, which could increase your risk of urinary tract infections. So that's number one. It can also irritate the delicate skin in the vaginal area, so you can get irritated. But there is actually one syndrome where it can cause real damage, which is nerve damage to one of the nerves that runs on your thigh. And actually, people can develop numbness and tingling in that area.
Really?
It's rare, but you know, I always say listen to your body. If you're wearing some piece of clothing, whether it's jeans or shoes that are really causing you pain, your body is telling you you have to stop.
People are saying not only have the allergy symptoms come early, they are worse this year than they've ever remembered them being. Why is that?
Well, as you said, it's very warm, so the trees are releasing the pollen at higher counts than ever before. And people aren't prepared because, you know, the trick with allergies is really getting the medicine in before the pollen comes out. And because this weather kind of came out of nowhere, no one was prepared. They're really not medicated beforehand, and they're really feeling the effects.
You have allergy sufferers all across the country praying for a cold snap early in spring. Would that actually change it, or is the cat out of the bag already?
Now it's too late. Once the pollen has been released, even if it does get cold over the next few days, it's really too late because your body has been immunized or triggered to that response.
And by the way, for the people sitting at home right now saying, I don't have allergies, this doesn't affect me, you can develop allergies at any age.
Any age, any time. I myself only developed them last year. You know, I never had them before. So absolutely, it could come at any time.
Why do I get headaches after sex? Am I allergic to my orgasm?
Some people actually get headaches after sex, and there's something called an exercise-induced headache that you can get after any kind of strenuous activity. And for people who get those, sex could be just one more exercise that causes headaches. But for other people, what can happen is you have a contraction of the muscles in your neck, in your scalp. While you're having sex, people do tend to tense up those muscles, and that can bring on a headache. So if you're someone who gets headaches like this, one tip is to take something like an ibuprofen about half an hour before you have sex, and that might prevent the headache.
What can I do about dark under eye circles, and what causes them? Is that because people wake up so early for work like the folks around here?
Well, it's not just due to fatigue. Some people, even if they get a great night's sleep, have the dark under eye circles. Part of it could be genetic, hereditary, but it could be a sign of allergies, nasal congestion. There's certain medications, like even some birth control pills that can do it.
So what do you do to narrow it down? Talk to your doctor?
Talk to your doctor, but you can try some things first. You can try a nasal decongestant, see if that helps. A cold compress in the eye can decrease puffiness. As we age, we get hollowing of the skin there. There are some plumping creams you can try, or even some fillers if you want to go that route with your dermatologist. It's interesting. For some people, it does have some anti-inflammatory effects. And, you know, it seems counterintuitive because we think, well, you have oily skin, you get acne, why would you put oil there? But for many people, acne is not because of oily skin. Some people with dry skin actually get acne. So it can have some anti-inflammatory properties similar to benzoyl peroxide, but if you don't want to use that, you want to go more natural, it's worth a try, but you should be careful because if you see any sign of irritation, you need to speak to your dermatologist. For some people, it has the opposite effect. You know, lactose intolerance can occur at any age, and we have less of the ability to break down dairy as we age, so this is something you really need to look at.
Well, often women are too embarrassed to actually discuss this with their doctor, so they're trying to diagnose themselves, or they're trying to ignore it or live with it, or self-medicating, which is a problem because you could be masking a serious condition.
Well, what really worries me is that so many women don't like to go on the scale. You know, they don't want to see those numbers. It just really bothers them. And they use things like clothing size to really gauge how fit they are, what kind of shape they're in. And as we can see, there's so much variability. There's some actual cheating going on. And to use numbers like that is not a good way to determine how fit you are. You know, you may be very overweight, have serious health issues, and not address it because you still fit into the size that you did 20 years ago. The door handle is pretty germy because people are touching with their hands, but the floor is the worst, and really any floor, because people are tracking in all sorts of junk on their shoes. They could be stepping in dog dew and God knows what else, and they're walking into your floor. So the first question is, why were you jumping rope after giving birth?
Well, it was 2 months later.
That's very impressive. But yes, it is normal to get those little leaks. What happens is you're carrying around a baby for 9 months. It's a lot of pressure on the muscles in your pelvic area. It weakens the bladder's ability to hold on to urine, and it will leak. If you cough, if you sneeze, you can definitely get that. But the answer is Kegel exercises. You know, the exercises that are supposed to make sex feel better will actually strengthen and help prevent that.
You know what? I was excited, to be honest, because this is what I deal with every day as a GI doctor. So I hear about gas all the time. So this is really common. It happens to all of us. And basically, when we're sleeping, we're not producing as much saliva as we normally do. So our mouth gets really dry and bacteria can overgrow. So what can you do? Well, in addition to obviously brushing and flossing before you go to bed, drink a big glass of water. That'll help you stay hydrated throughout the night and will hopefully prevent a little bit of the morning breath. There is something called a spontaneous orgasm, which happens without direct stimulation to that area, and some women get it from like friction in that area. So if you're riding a bicycle or even if you're holding in some pee, you know, you're clenching your muscles, it can happen.
And you can have an organ. Can you buy that anywhere?
Can you train for that?
Can you get it during sex?
When you really need it.
It's totally misdirected.
Let me ask you about those things, because people who are like on a diet, and there are a lot of people who just say it's just it's healthy for you. The colon cleanses. Remember Princess Diana? You know, they wrote about her, thinking that was a great thing to do.
Any good?
No, they're not. And you know, I hear this all the time in my office because one of my specialties is gastroenterology. So people come in all the time. I heard about a cleanse. I did 10 cleanses. There's no medical reason to do it. And you know, your colon does a great job on its own of cleansing it. If you feel backed up, you know, add fiber, talk to your doctor. But these things could actually be harmful. Anytime someone's inserting something in there, you have to be careful.
Okay. Let me ask you a question.
Do you think anytime, Dr. Raj? Anytime.
All right. Anytime. Let me ask you a question about men.
Yes.
About a man.
Yes.
When a man reaches a certain age and he starts to wear banana-colored pants and part his hair and under his armpit, is he in menopause, and is there such a thing?
Yeah. So there is such a thing as male menopause. We call it andropause because testosterone is an androgen, one of the sex hormones. It does start to fall as men age, just like we have our estrogen, which falls. But the similarity kind of stops there. It doesn't fall quite as dramatically as we have it, and we're not really sure what effects it really has.
Well, they leave their wives, is what happens.
Elizabeth, did you? I do. There's another question. Bathing suit shopping. There's always that paper inside the bathing suit bottom that is there to keep you safe, but everybody's trying on the bathing suit over the same
on.
panty. Then why do they have the paper there?
Because some dummies won't take their underwear off.
Can you catch anything from the little crotch paper?
That's disgusting.
You know what?
It's yuck.
Exactly. The whole book full of the stuff. Yeah, it is actually dangerous to try it on without any underwear. That paper is to protect the bathing suit from stains.
Oh, not you.
It's not to protect you.
So keep your undies on.
Keep your undies on. Things like, I mean, I won't even tell you, but gross things can happen when you let it.
Dr. Raj, thank you so much for answering these questions.
Today's show is inspired by a book that I love so much, I keep it in one of my favorite places to read, the bathroom. It is called What the Yuck? And for every one of you who's ever had a question about your body you thought was just too gross to ask your doctor, well, we're taking all those questions today, covering every excruciatingly embarrassing body part and bodily function. We're leaving nothing to shame, because even the grossest question can reveal something important about your health, even if it has you asking, what the yuck? Now, let's get started by meeting the author of What the Yuck, who just so happens to be a doctor herself, gastroenterologist Dr. Roshini Raj. Welcome here.
Thank you.
So I should say, you know, we cover all these themes in the book. What inspired you to write a book about the grossest bodily functions of women?
Well, you know, for women, we're always taught from our grandmothers and our mothers there's certain topics that are off limits for nice ladies. But the truth is we do need to talk about our bodies and our questions, because if you don't, it could end up really harming your health. So even the grossest topic is not off limits when you're in your doctor's office.
So for that reason, we've asked some of our viewers, and they're right over there. There are a group of ladies with some of the grossest questions we have ever discussed on this show. And today, they have agreed to show their faces, and they are coming forward on behalf of all women who want answers. Thank you for doing that. Rosemary, come on up, Rosemary. Come on up, Rosemary. She's the first to answer her question. Thank you for coming forward. Come on up. So, what's your question?
Well, I'd like to know why during that time of the month my bowels decide to get me to have the most grossest, disgusting, explosive diarrhea.
Explosive diarrhea.
Explosive diarrhea.
So Dr. Raj actually is a gastroenterologist, so I'm going to have you tackle this first. Is this a common occurrence?
It is. You're certainly not the first woman to experience this during your period. And what's happening is the same chemicals that cause those uterine contractions and cramping, they're called prostaglandins, can also cause your intestine to cramp. And that basically is pushing out the bowel movement in that explosive and really disgusting fashion. But, you know, it can be an embarrassing and difficult problem.
So let me explain what Dr. Raj said, because it's going to make a lot of sense to you.
Okay.
Those hormones, which are stimulating your menstruation, are also stimulating the small muscles inside the intestines. So go ahead and squeeze that. We can all do it together. So as you squeeze, and sometimes it's normally a little bit of squeezing to move the food through, but at that time of the month, with the surging amounts of hormones that are making your uterus evacuate itself, the same thing happens here. Harder, go ahead, help her. And then all of a sudden it gets to the end, and it all builds up, all that gas comes down here, and at the very end, it waits until you have a moment free, and then out of nowhere, explosively, that happens. Does that look familiar?
Not that color. And you got some on your face.
But it's worth it. It's worth it if we can talk about this. So, Dr. Raj, what can work for women who have a problem that's obviously embarrassing and awkward and gross, but common?
Right. Okay, so to combat those prostaglandins, those chemicals we're talking about, you can try ibuprofen, just like you do for your cramps. So taking 400 milligrams every 4 to 6 hours as needed can help. But you also want to look at your diet and add some fiber to your diet that can really bulk up the stool, which will hopefully prevent this embarrassing problem.